Well, good evening, everybody, and welcome to this month's Life Lecture on thermography. Barbara Calcagni is a certified level 2 clinical thermographer. She's had extensive training and she is certified with Metatherm in the UK. She is very passionate about thermography and believes that painless, non-invasive ways to prevent and detect disease are certainly preferable to invasive, painful ways. So when medical testing is indicated, she feels that opting for screening techniques that do not result in bodily harm are the best place to start. She says, I believe that knowledge is power when used to make decisions about your health and must be shared so that all individuals can make educated choices about harm-free medical testing alternatives when appropriate. Excuse me. And Barbara says she also looks forward to the day that all healthcare practitioners will work together as a team for ultimate patient care. So what is thermography? How does it work? What kind of scans are available? Who can get them? What are the benefits and the downfalls? And some examples of what thermal imaging identifies and how to understand your report. So Barbara, thank you for being with us this evening. And I'm going to turn this over to you now.
All right, thank you. I wish you guys could see me, but you're not missing anything. Anyhow, okay. Yeah, thermography has been around for a long time. And I think it started in the 60s or 70s to become a little more popular. And then we even had it in our local hospital. People were starting to embrace it. And then something changed. And the something was the radiologists got a little upset because they thought maybe we were in competition with them. So they went to the FDA and they said that they didn't want thermography used as a breast screening tool. And so since that happened, the FDA did say that they approved thermography. They knew that it worked, but they had to compromise somehow. And that's why it is listed under the FDA now as an adjunctive test to mammography. So that is how that happened. So we're going to just go through and I'm going to tell you everything that I can about it. My camera is portable, so I can take it to any different office. And that's why I have this little breast health on the go here because I travel everywhere. Thermography can see everything from head to toes to the bottom of your feet, your fingers, everything. There's only two places that thermography cannot see, and that's inside the brain and prostate for men. And we don't scan those two areas because the visibility is low and we feel there's better testing for those areas. So what is thermography? It's a state-of-the-art clinical imaging procedure for detecting a number of diseases and physical injuries by showing thermal abnormalities present in the body. We can see down to the cellular level, and it is, everything sort of comes from the sympathetic nervous system, or the sympathetic functioning through your body. And we see things that are physiological, like inflammation, pain, neurological things, injuries, diseases, and function of the body. And we take the whole body into consideration. And when we're doing breast, we don't just do the breasts, we do underarms, we do the chest area, we do the back area, both breasts, and we just feel everything to get the total picture is much better than scanning or looking at one part of your body. It's radiation free, so it can't harm you. There's no body contact, so there's no crushing. It's not painless. I'm sorry, it is painless. And again, it was approved in 1982, and our reports are read by all medical doctors who have extra training for 3 years. They're board certified thermologists, and without that 3 years, we won't accept a doctor. So most of our doctors have like 30 years experience in reading these reports. They're very good. And we have approximately 65 doctors, and we have thermography all over the world. And It's funny because a lot of other countries know about thermography and they've been using it for a long time. And people in the United States don't know much about it, unfortunately. Just through things like this, word of mouth. I don't even advertise anymore. I get most of my patients through word of mouth, people telling each other about thermography and the differences and the things, how it helped them, with getting their reports and everything. So that's how we kind of work everything. I do one region of interest scans. That means anywhere in a body, like I have several dentists that send me their patients because they want to see where the inflammation is in people's mouths. That's thermography. That's the number one thing that it finds is inflammation. And other testing can't pick up inflammation. X-rays don't show inflammation. And for the dentist, they want to know exactly where that inflammation is. And they'll send them to me and I'll scan them and they send back their pictures and they get their dental work done. It's mostly helpful with root canals. Root canal problems are becoming more and more prevalent. They didn't know before that the roots from root canals go way down into your body. It can cause a lot of inflammation, a lot of health problems, a lot of sickness, can even, bad teeth and poor oral hygiene can actually even cause heart attacks. So it's really important to keep your dental work up. The breast scan, like I said, it's thyroid, underarms, breast and back. I would say a good majority of my patients are really interested in breast scanning, especially women. I only have a few that come for other reasons, but breast screening is the number one reason that they come. It seems like a lot of women are just fed up and they're tired of getting mammograms. And then I move on to half body. That's from head to pelvic area, or you can do hips, legs, knees, ankles, and feet and toes, whatever you want to do. Most people will do, if they do a half body, they do an upper half body because you get a free breast scan with that also. Full bodies from head to the bottom of your feet, and that includes your arms, your fingers, everything, except for prostate and brain. The role of thermography in breast screening is a little different than mammography. The major benefit is early detection. We can detect early changes in breast before turning into disease. And so our test is not made to just find present cancer. And that is what mammogram does. It only finds present cancer. And when I do presentations, I ask ladies, raise your hand if you think mammogram helps you prevent cancer. And they all raise their hand. It doesn't help prevent cancer in any way. It only finds it if it's already there. That's why a woman can go and get a mammogram, and the next year, they're fine. And the next year they go, and oh my goodness, now you have cancer. Where if they would have been having thermal scans instead, they would see a lot of these minute changes happen before turning into a disease. And we think that the focus should be on prevention. And prevention is more important than catching a disease already that's present. And the reason it's so important is it provides time to intervene and change the outcome. So what kind of changes are we looking for? We're looking for lymphatic dysfunction, lymphatic congestion, lymph node pathology, hormone dysfunction, estrogen dominance, vascular problems, the development of new and abnormal blood vessels is known as angiogenesis, and that angiogenesis usually happens right as cancer is forming because it needs a feed to make it grow. Inflammatory breast cancer cannot be seen on a mammogram, and women don't know that. And unfortunately, inflammatory breast cancer is one of the cancers that a lot of young women get. And it is commonly and routinely misdiagnosed as mastitis. And then by the time they catch it, it's too late. It is a really fast growing cancer, and the outcomes are very bad usually. Another thing we find is functional physiology abnormalities, which is a large range in scope that other testing cannot find. The goal is to use every appropriate test available to get the highest detection rates without additional or unnecessary invasive testing. So we don't want people to go, especially women, I guess, keep going and getting testing that says, oh, we think we see something. Now we got to scan you again. And then they'll say, well, we think there's something there. So then they want to do a biopsy. And this whole time, there's a lot of mental anguish for women because they think they have cancer. And there's no test that can diagnose breast cancer. Biopsy is the only definitive way to make a certain diagnosis. But now there is some specific blood testing that may be used by some medical professionals also. It used to be only a biopsy could tell you, but now, like I said, there are some holistic doctors that I know they're using this blood test to see if they have the markers and everything for cancer being present in the body. And also you can, I think you can have that test done even like through a third party if you want to pay for it. So that's available to women now also. So what's the benefit of finding all these things? You know, women are just used to going and getting a mammogram and finding out if they have present cancer or not. But we want to explain what else we can find and what the benefit is. So whether it be like hormone dysfunction or lymphatic congestion, estrogen dominance, inflammation or infections or angiogenesis, all these things can be corrected before it turns into the disease. So we are trying to help you prevent breast cancer. How do we do this? Balancing hormones. Well, you can reduce stress, exercise, try to maintain a healthy body weight, eat healthy, get enough sleep, balance naturally or with, you know, identical hormone therapy. You know, a lot of people will take bioidentical hormones and they're better than the synthetic ones. Excuse me. Also lymphatic massage. Lymphatic massage is great. It can eliminate or greatly improve the lymphatic system. And it's very helpful following any kind of breast surgeries or mastectomies. A lot of doctors don't have women go and, you know, tell them that this is available, and they end up with lymphedema in their bodies, and especially around their breasts and their arms, because a lot of that fluid and toxins gets trapped in there, and all they need is lymphatic massage, and helps them greatly. Excuse me. Estrogen dominance, that can be reversed by dietary changes, a reduction in alcohol intake. I'm cutting off my words here. I think it's something about the diet, something about the carbohydrates, getting more fiber into your diet, magnesium, etc. The angiogenesis I told you is blood vessel formation that starts when disease starts to develop. Now, this is just a few things that we can find, but in order to avoid breast cancer, there's so many things that everybody can do. You can eat better. You can get the chemicals out of your life. You can stop using chemicals on your body. You shouldn't wear tight bras. You shouldn't wear bras that have underwire in. There's so many things. You know, you should be drinking clean, filtered water. Our tap water is contaminated. Our air is contaminated. The food's contaminated. All the products we use. Did you ladies know that fragrance has like 2,000 chemicals in it. The word fragrance. Yeah, I mean, in all of our cosmetics, we are bombarded with all kind of hormone disruptors, and then they wonder why breast cancer is on the rise. So all that's very important. Thermography is perfect for all women. Women who have dense breasts, which is 40 to 50% of women. And what happens is it causes repeat scanning and false positives and unnecessary biopsies. Breast implants, thermal scans cause no damage to implants because we don't compress the breast. And we can also see leakage. If you already had breast cancer, we can help find the earliest physiological changes, earlier detection, early outcomes. Especially since you already had, breast cancer, you probably need to, it would be great if you would use thermography also, because we can see things at an earlier stage before it turns into cancer again. I'll tell you a story about a young man that came to see me. He had cancer on his arm, and the doctor took the cancer out of his arm. A few years later, he came to me and he said he wanted his arm scanned again. And I asked him why, and he said, well, because the doctor thinks I might have cancer in the same area again. And I said, well, did he test you in any way? And he said, no. And he said, that's why I'm here to see you, because I don't want to have an operation if I don't need one. And I said to him, well, whatever, happened that you got cancer, that was such a weird place because it was sort of like below his shoulder there. And he said, no one ever asked me that. And he said, oh my goodness, he said, a car fell on his arm when he was younger. So what happened is it weakened the area. And that's my point. Once you weaken an area on your body, you're more likely to get cancer in that spot. And so that is another reason I don't like mammogram with the crushing, because I believe that it does damage to your breasts. And every year doing it over and over and over, once you have breast cancer, after they operate on, it weakens the area. So that's why I think it's important for women who already had breast cancer to use thermography also is another option. And then there's women that are too young for mammogram. If you're under 39, they don't tell you to get a mammogram because they know that the radiation is very bad for you. So there's a lot of young women who get breast cancer. And I know someone that was 14 years old that had breast cancer. So, I mean, these young girls are being totally ignored, and they just show up and have breast cancer because they know they can't start screening them at that young age, because all that radiation will definitely turn into cancer. So I think the answer for them is thermography, but the doctors don't talk about it. They don't recommend it. And we cannot understand why. But I mean, I know why. It's profit. And, it's always about the money, and we don't make a whole lot of money on thermography. We don't accept insurance, so the insurance can't dictate what we do. We try to keep our prices low to make it affordable for everyone. And we don't want tied up with big pharma. We don't want to be under their thumb and have them tell us what to do either. So, and also then the last one on here is women who refuse mammogram. I have a lot of ladies that come to see me and they say, I'm not getting a mammogram. I never had one and I don't want one. And they don't want the pain, the radiation exposure, or the crushing. And so they come to have thermography done. I think that's great. If we find something that looks suspicious, my doctors will put on a report to, please go and get further testing, because obviously they see something that looks suspicious. And I always recommend women have an ultrasound. An ultrasound is the exact same type of test as a mammogram. It's a structural test, but it can't hurt you. We have something that we call a thermal breast baseline, a thermal imprint. That is the very first time that you get a breast screening. If you're coming to me and you're going to do breast screenings, you need to come back 3 months later and get another one. And the reason is it's just your breast imprint is exactly like a fingerprint. You're unique, you have your own. And the only thing that changes it is developing disease or present pathology, or if you would have surgery. And this picture here, this is the inflammatory breast cancer that I told you about. That's common in young women. So that's what you want to definitely catch early, very early. Lymphatic congestion, again, I've talked about that before. Your system fails to drain properly. You're building up all those toxins, cellular waste products accumulate in the body, and it gets trapped in there. But with simple lymphatic massage or treatments, you can get rid of that. What else can we see? We can see benign cyst, fibrocystic disease. This other one is cancer in the left breast. A fact is only 20% of women who get a biopsy will be diagnosed with cancer. So see, they try to make women so afraid of breast cancer, and that's how they get what they want. They use fear. Be so afraid. You should be so afraid of your breasts. And we don't want you to be afraid. There's less breast cancer than what you would think. It is on the rise because of everything, but it's not as common as what they would like you to believe. 50% of women never get any breast screenings ever. Did you know that? Isn't that amazing? I would have never, ever thought that was possible, but 50% never, ever get breast tested. A family history of breast cancer may put you at higher risk, not necessarily, because, and a good doctor will tell you that maybe bad habits are what comes down through the family, not just the genes. You know, maybe your grandma made lots of fried foods and ate a lot of fat and things like that. But now things are different. People take better care of themselves, they exercise, they eat better and make better decisions. And so that wouldn't put you at a higher risk, even though maybe somebody in your family did, have breast cancer. Women delay screenings because of fear. And again, because our society, keeps reminding you to be afraid of getting breast cancer. Many women are rushed into retesting, biopsies, and treatments. I would say in the last couple of years, a lot of women tell me they went for a mammogram. They had to go sit in a waiting room and they come out and they say, we think we see something. So then they got to take them back in and rescan them again. So you're not getting radiated once, you're getting radiated twice. And why I think this is so strange is because I would say 90-some% of the women tell me the exact same story. So they're seeing this in 90-some% of the women, they need to rescan them. That seems a little high to me. So, and I'll let you know later about the radiation in the mammograms. Most lumps in breasts are 80 to 85% benign. Fibrocystic breasts are often associated with localized tenderness and lumps, which is normal. No doctor will tell you that fibrocystic breasts are lumpy and tender, and that is normal for them. I have a mom who's 86 years old. She had lumps in her breast her entire life. She's never had breast cancer, never had anything. And a lot of women are the same. You have lumps that come and go. Not every lump means you have cancer. But, they use that as fear to get you in there to do biopsies and testing and treatments. That being said, no breast testing is 100% accurate. They all have their flaws. Nothing's 100%. You can get false positives, false negatives. You can have cancer and it might not be seen. I know with thermography, there's 2% of the cancers we may miss because it can be encased. A lump of cancer can be encased, like, say, inside like a balloon. It's all encased. There's nothing going in and there's nothing coming out. There's no activity. There's no new blood vessel formation, nothing. And so it would be silent for thermography. So thermography is about 85% accurate. Mammogram, for what it finds, is 80 to 85% accurate also. That's why sometimes combining tests, I would say, like thermography and ultrasound would be a good idea for people who are at higher risk, maybe have a lot of family history, say mom had it, grandma had it, my sisters had it. Somebody like that, I would say, don't just do thermography, because I don't think that you would be satisfied with just one type of testing. If you want to be sure, go and have an ultrasound too every year, and then their probability goes up to like 99% accuracy. So, if you're normal and no one has anything in your family and you never had any problems, you can probably go longer with thermography without doing any other testing. I have ladies who will come in, maybe do thermography for 3 years, and they'll go 1 year and they'll have an ultrasound just to break it up. And there's nothing wrong with that. You don't have to do. And if you want a mammogram, you can do the same with mammogram if that's what you want. The idea is to not have a mammogram, I think, every year because of the radiation and the crushing. The damage that the radiation is doing is accumulative, and women don't know that. If you talk to the doctor and you tell the doctor that you are concerned about the radiation, well, they're going to tell you, well, it's not that much, it's low dose. Well, let me tell you about low dose. Low dose is worse than high dose. High dose goes through your body, hits the lead in the walls. Low dose stops in your body, does damage. And every time you have a mammogram, it damages more and more and more. So it accumulates over time. But see, the doctors don't tell you that. And I believe that that's why there is so much breast cancer. How many ladies have heard of the breast density law? I don't know if anybody raise your hand if you ever heard of it. No? Well, in 2009, in Connecticut, it was the first state to pass a breast density notification law, and then other states have followed. And like I think I said before, 45% of women have dense breasts. Now, what that is they will send, this is an Excella health letter that was sent to one of my patients. She kindly brought it in for me because I don't get mammograms, of course. And they go through to tell you, once you have dense breasts, they are now, by law, they have to send this letter out to you. And the most important sentence in here is, I typed up here in this red, dense breast tissue may make it harder to find cancer on a mammogram. And so it increases your risk of cancer. Now, why is that so? When I read this, it makes it sound to me like density is a problem or density is abnormal. It's not. It can't be abnormal if half of the women have dense breasts. So mammogram cannot distinguish between density and cancer. Why? Because they both look white on a mammogram. So in other words, mammogram cannot distinguish between cancer and density. it looks exactly the same. And what was happening was they were actually missing cancer because they can't see through density, but they won't admit that. Mammogram only finds cancer after it's developed. It has nothing to do with prevention. It does not prevent breast cancer and has not changed the mortality rate of deaths from breast cancer since day one. The scientific studies are in, has not improved the deaths from breast cancer. Even though people think that it finds it at an earlier stage, it doesn't prevent women from dying. Studies have found women are more likely to find breast lumps on their own earlier than with a mammogram with monthly self-exams. A lot of women won't do self-exams. I ask ladies all the time, and I get answers like, "Oh, I'm not touching them," or "Oh no, I don't do self-exam. I wouldn't do that." And I mean, it's your body. It's just like your arm or your leg or anything else. I mean, you should be doing self-exams. It's easy. You can get on a YouTube video and it'll show you how to do it. Depending on your doctor, doctors were told to do breast exams on ladies. I don't know if they do them or not anymore. I know some do and some don't. And I don't know why they quit doing them. Mammogram can find lumps and calcifications because that's what it finds. Mammogram is a structural test. So it can find lumps, like I said, not meaning if it's cancerous or not, just find it, and calcifications. And calcifications doesn't mean that you have cancer either. When you have calcifications, our radiologist told us that they watch them because what they're looking for is the shapes of those calcifications to change. If the pattern and the shapes change, then they're concerned about it. Otherwise, they let them alone. Ultrasound is a good test because it doesn't crush or contain radiation, but for some reason, women have a really hard time getting an ultrasound. Now, my recommendation is if you want an ultrasound instead of a mammogram, ask your doctor to write you a script. But that's still no guarantee because I've heard a lot of stories. They go to get their ultrasound and the radiologist comes flying out of the back and starts to tell them that they must have a mammogram first. Well, and then of course the patients say, no, my doctor wrote me a script for ultrasound. And the radiologist just keeps it up and they won't let you go. Now, the worst thing I heard yesterday was one of my patients told me that she had a script for the ultrasound and they came out of the back, told her she had to have a mammogram, and she said she refused. She said, no, I am not having a mammogram. And she had a very good reason. She had a medical condition in her breast that wouldn't help her condition anyhow because a mammogram couldn't see through her breast tissue. But they still told her she had to have the mammogram. And so again, she refused and they would not give her the ultrasound. They left her walk out of the facility without giving her any breast testing. So that was the first, very first that I heard that. And my suggestion to her was I would get on the phone. I would call every facility that does ultrasound and ask them, say, I have a script for an ultrasound. Is there a problem with me just getting an ultrasound? There has to be facilities that will give you the ultrasound. I don't know, do you people know who Dr. McCullough is? He's a very popular doctor. He's been around for a long time. He believes in thermography. He knows that mammograms aren't the best choice for breast testing. Also, he brought up the study that was done in Canada. It was a 25-year study about women aged 40 to 59, how they found no benefit who were randomly assigned mammograms. As you can see on the chart, with mammograms and without mammograms. The same amount had received breast exams and mammograms. The other one just received breast exams. The women who had the mammogram, the numbers are the same. Had a diagnosis with breast cancer, the same on the other side, a little less. Even the death rate from breast cancer, 500 women died, 505 women died from breast cancer without the mammogram. So see, the numbers are very, very close. And that is why a lot of countries have been rethinking mammogram now for years. They just feel that it is an outdated test, that it's causing more problems than it's helping, and it hasn't changed the mortality rate at all. And the death rate from breast cancer was the same in both groups, but 1 in 424 women who had mammograms received unnecessary cancer treatments, including surgery, chemo, and radiation. And once you have chemo and radiation, you are 30 times more likely to get cancer again. And that's another thing they don't tell you. So Dr. McCullough says, mammograms can actually increase your risk of cancer. Despite what you hear from medical sources, mammograms expose your body to radiation 1,000 times greater than from a chest x-ray. So that's what you want to know more than anything. One mammogram is equivalent to 1,000 chest x-rays. That's how much radiation is in them. And that's why breast cancer is so prevalent. So I think it's time to rethink. Did you know that Switzerland completely abolished mammography screenings? The board chose to recommend canceling mammography screenings altogether. Thermography clinics are being used across the country in the UK and in Wales. In 2019, the European Breast Guideline recommended against annual mammography. They talked about detection versus prevention. Just like I say, mammogram only finds present cancer. We are trying to prevent it. Prevention is more important. And they feel that radiation is toxic, the crushing is painful versus do no harm, no touch. That's why they're doing thermography. In the US, the gold standard test is still mammogram. Breast cancer is still on the rise. Mammogram has not changed the mortality rates. Radiation increases your chance of cancer by 30 times and accumulates over time. And smashing breast between two metal plates damages breast tissue. This is some things that you can look up if you're interested. You don't have to just listen to what I tell you. Some websites, the European Journal of Public Health, The Promise, that was a film documentary. Actually, a couple of my, our doctors are in it. And they shed light on the practice of mammogram and feel that it's useless and harmful to those who take part in it. The Truth About Cancer from Ty and Charlene Bollinger. It's a 9-part docu-series that has reached millions of people, saved thousands of lives because people watched it and got cancer and weren't so afraid and did a lot of things that could reverse it. So when it comes to breast cancer, I just believe prevention is better than cure. Finding issues and correcting them before turning into disease, or you can find it after it's a disease. It's easier and more cost efficient to get and stay healthy than to cure a disease. I have a lot of ladies that don't want to come for thermography, not a lot, but their excuse is, well, my insurance doesn't cover it. I charge $165 for a breast screening a year, and I don't think that's a whole lot. That's a couple Starbucks drinks. I mean, to save your life, to prevent breast cancer, I think it's pennies. If you get breast cancer, You'd be surprised how many thousands of dollars it's going to cost you. People think that their insurance pays for everything. It doesn't. And so we're going to move on now and leave breast cancer behind. And we're going to talk about the rest of scans and types that you can get and what it finds. As I mentioned before, inflammation is the root of most diseases. And a lot of people, especially women, are told, you know, this, I can't really see this. This was a Pittsburgh patient. She was to many different doctors. She was having a lot of problems. And women always get the answer, well, maybe it's all in your head. If a doctor can't find out what's wrong with you, they tell you it's in your head. Well, we don't think that. We think if people have no one wants to be sick. I think everybody wants to feel good. So all these things come from inflammation, obesity, diabetes, cardiovascular disease, colon and breast and lung cancers, metabolic syndrome, arthritis, Alzheimer's disease, lots of things. Thermography works with the sympathetic response to inflammation and works with the blood flow. So inflammation at the tissue depth will be recorded by the sympathetic fibers in a neurological supply to that area. The neuroinflammation will be processed through the central nervous system, which will cause a sympathetic response in the area of skin corresponding to the affected site. The area of hypothermia seen thermographically at the skin surface is due to a decrease of sympathetic motor tone, reduced sympathetic function, allowing increased blood flow through the postganglionic sphincters serving that area. This is for somebody that wants to know exactly how it works. But this is how the doctors can see which organ may be dysfunctioning or have a lot of inflammation, that something's going on. The heat will always go from the organ to the surface, and that way they can locate where it's coming from and what's happening. Pain, we can see the pain, but we feel instead of covering up pain with medications, why shouldn't we look for a problem and correct it, causing the pain to go away? Instead of taking all these medications to stop people's pain, you know, CBD oil is the great thing. All these places have opened up, but it's doing the same thing. It's covering up pain. It's not getting to the problem and correcting the problem. So, you know, I think the CBD oil is a good thing for people. There's many people with cancer now that suffer that helps them every day. But again, it's doing the same thing. It's just covering up symptoms. It's not correcting the problems. Full body imaging is from the head to the bottom of the feet, fingers and toes, finding unusual thermal patterns that identify abnormal physiology or function. This is some of the things now that thermography can find. TMJ is difficult to diagnose, but we can see it really easy with a thermal image. And on this second one, T1 and T2, you see the blue spot at the base of the neck there, down, it's like a circle. Right away, that tells you that this person has an autoimmune disease. So with one shot, we can tell you if you have an autoimmune disease. Now, which one it is, we can't tell you. Sometimes they can if it's thyroid, because when I scan the thyroid, you can see that the thyroid is not functioning properly. So easy to find. So that's head in the back of the neck. That's just a couple things. We can see any dental infection, which I talked about before, problems with root canals. And oops, we can't see this, but we can see carotid arteries that are blocked. And I see a lot of men will come and get a scan, and a lot of them have blocked carotid arteries, which is great when they come, because then they can go and find out how much of a blockage they have. Most people who have blocked carotid arteries end up with having a stroke. So until that happens, they don't even know that they're blocked. And this way they can find out that they're getting a blockage before it happens. Thyroid dysfunction, that's what that looks like. And heart disease. Everybody that has heart disease has this cold spot over their heart. Very easy to see. They will also have a cold spot on the back directly behind this. Diverticulitis, we can see that. Kidney infections, stress fractures. This person had a disc bulge. We see a lot of back problems. People will have problems walking, problems in their legs, coming from their back, their spine, they have problems in their back. Phlebitis and varicose veins, that's what they look like. We can see carpal tunnel, sprained ankles, and so much more. Plantar fasciitis, RSD. We can scan Fido and horses too. We have a girl in the UK, she does horses full time, that's what she does. And my daughter's dog wasn't feeling well, and she was having a hard time walking. And so I scanned her, and the doctors found a tumor in her spine. So, but it's really tough to sometimes work on animals because you got to get them to hold still. And then this is a list of a lot of other things that we can find. The list is very large and very in-depth. And so thermography has so much to offer that people don't even know about. And we just hope that someday, doctors will rethink thermography and give it the value that it deserves. And we can all work together to make patient care, harmless and painless and more natural than just starting out with pharmaceuticals and surgeries. We just think that that is a better way to go. So anyhow, any questions?
I have a question, Barbara.
Sure.
You said that you don't take insurance, but if someone has like a health savings account, are they allowed to use that for?
Yes, absolutely. Yeah.
And another question too, say you go see your gynecologist for like an exam, and of course they're going to tell you to go get your mammogram, and then you tell them, hey, I'd rather have this instead. How do you go about contacting you, or how does that work?
All you have to do is call me for a scan. You don't need a script or anything else. You are self-referred. And what you would do then is take your scan to your doctor. Excuse me. And what you tell your doctor is this: I am refusing mammogram. I will agree to have thermography. If the thermal imaging finds something that's of concern, I will agree to have. You can say mammogram if you agree to it, or you can say I will agree to a ultrasound, or you can agree to have an MRI. Whatever you want to do. Now, if your doctor says to you, well, I don't believe in thermography and studies have said it doesn't work, well, you can say you believe that it does work. You can look up and read yourself, the articles that I showed you, and do some more in-depth research. But I always say, if a doctor is not willing to listen to what you want and what's important to you, then find another doctor. It's just like anybody who mows your grass, maybe comes and does work on your home. If you don't like the job that they're doing, you fire them and you get another one. I can tell you that I have been telling ladies this for years, and they are getting backbones, and they are going to their doctors and they're saying, I'm not having a mammogram. And you know what the doctors say? Most of them will say, okay, all right, yeah, you can get the thermogram, just bring it to me. Now, if you get one that's the opposite, get a new doctor. That's all I can say. There's plenty of them out there. And I can tell you, I have scanned doctors, female doctors, they come to see me and get thermography. So that says a lot right there. Okay, anything else?
Yes, Barbara, first of all, in response to Jennifer's question about contacting you, we do have Barbara scheduled to come to Moundsville on Friday, June the 10th. And I believe there are still a couple of spots left on the schedule. And that will be held at my office. That's the Spot Massage and Wellness, corner of Route 2 and 6th Street in Moundsville. And if anybody's interested in scheduling, you can get in touch with me, and we'll get you set up. But I'm also curious, how does estrogen dominance show up on a thermographic image?
Well, it is the pattern of the hormone fluctuations that they know. The doctors know, they can tell the difference because the doctors take my images and they have special software. They can blow my images up to 300 times.
Wow.
So they can manipulate, turn them. They see through different eyes. I personally cannot see what they see. I mean, we can see inflammation and we can see the shape of the body and everything, just like in the pictures I showed you. But their equipment and their training shows them so much more. So that's how they tell. We even have now, they have an immune and hormone scan too that they do now. But most of the doctors will tell you if you have a hormone problem when they look at a breast scan anyhow. But how you want to develop, how you want to take care of that is up to you, because some people still want to do conventional medicine. And so you would just go see your medical doctor. And a lot of other people are doing more holistic and alternative doctors now, like naturopaths. And they'll balance out your hormones and things with supplements. Diet changes, things like that. And it can be done. It's being done. You don't have to take pharmaceuticals. You can go the natural way, which is much healthier. Now, it takes longer. Anytime you use something that's more natural opposed to a pharmaceutical, takes a little longer, a little bit more effort. But in the long run, something natural can actually cure something or correct it, where a pharmaceutical will always just cover it up. It doesn't cure anything. And that's the difference.
Right, very true. And our friend Carol Lilly, who had to leave the meeting earlier to get to a different meeting, is a naturopathic doctor, for those of you who may not be aware. And she also is available to help with these sorts of things that Barbara has mentioned. So,
right. Dr.
Anybody
Carol,
else?
very good doctor.
Yeah, Dr. Carol is very good. Yes.
Yeah.
She's helped a number of people in a lot of different ways. So
Exactly.
she's a pretty good midwife too, or doula, not a midwife. I guess she's a doula, but she loves her babies. So, are there other questions, comments?
I have a comment. This has been very enlightening because I really didn't know there was any other options. I actually, in the last few years, have refused to get a mammogram. So I haven't been checked, and that always kind of was worrisome, but I agree, the last time I've had one, it was very stressful. They said I needed to, they did it, the scan, they looked at it real quick and said, well, you have to wait a minute. We have to have a doctor look at this because you're going to have to get rescanned. That scared the bejeevers out of me because I'm thinking, why? What's wrong? What's wrong?
Right away, you
Um,
think something's wrong.
Right.
Exactly.
And like I said, it's very discomforting. You're in pain for several days.
Mhm.
And so I just have refused to get one. I
That's
just
a
don't.
yeah.
So
That's
this
a
is very enlightening. I think
right.
I was always looking for alternative ways. I knew there were alternative ways. I just didn't realize this was it.
Mhm.
So I think this is fantastic.
Yeah. And Jennifer, that's a very common story. The same thing I hear from many, many women, and they've had it. They're just tired of it. You know, going in and they scare you every time. And oh, we think we see something. It's always, oh, we think we see something. Well, after you do that so many times, it's like you do this every day. You've been doing it for years. Why are you saying we think we see something to every patient that walks through the door and double radiating them? I don't understand. Um, so yeah, I mean, enough's enough now.
And I
And
remember you mentioned something about like white spots. I
yeah,
remember vaguely them saying something about we can't determine between like if they're just like fat cells or something else. So we just want to double check. And
yes,
when you mentioned that, I'm like, yeah, that was me, you
right.
know.
That's density,
Hmm.
breast density, and it looks white on a mammogram, and it looks the same as cancer, and so they can't distinguish between the two,
Hmm.
and so they will rescan you, trying to get you at a different angle to see behind it. But then again, you're getting radiated twice.
Yeah.
So now it's not 1,000 chest X-rays; it's 2,000. So, but to go back to what you said before too about the insurance, there are some policies that do cover thermography. I have ladies, but they're not on like Blue Cross Blue Shield or UPMC, not the big companies. They have maybe smaller policies from their churches, smaller policies from their workplace. They pay for thermography 100%. So it's just these big companies that are in with, big pharma that will reject it. And they like to pretend like they don't even know what thermography is, even though it's been around for all these years.
That just amazes me too.
Yeah,
How this does look like a very good, safe, and healthier alternative. And you're right, it is all about the money. And
yeah,
it just
it
makes
is.
me so upset thinking, well, I'm just chopped liver.
Right. Women have been duped for years. All you hear from the time you're little to the time you grow up is mammogram, the gold standard test. That's what you do. Every year you go for your mammogram. Well, many times I've done presentations in front of people, and I can tell you that there's women who got so angry with me, they got up and they walked out. They could not accept the fact that maybe what they were doing all these years wasn't the best thing. And they couldn't handle it. They didn't want to hear another word. Unfortunately, I mean, it happens. Some people just can't, you know, hear the truth. And the only way that this is going to become more popular and this mammogram uh, abuse in the United States is going to stop until women demand and say, we're not taking it anymore. We're tired of this. Other countries are turning towards thermography, um, doing things different. They did the research. They know it doesn't stop, mortality. It's causing more harm than good. All these procedures being done, all the, you know, cutting off breasts and telling people that they have cancer. DCIS, they were taking, that out. It's a little lump for years cutting women's breasts off if you have DCIS in your breast. Just take it off. Just take it off, they said. Now they know DCIS isn't cancer. It's not cancer. It's 0-stage cancer. That means it's not cancer. And that's not to say there isn't real breast cancer and very bad, quick spreading cancer, but they jump the gun all the time. The same as fibrocystic lumps. That doesn't mean they're cancerous. You don't have to run and have you in by Monday. If they find something on a mammogram, you can bet they have an opening on Monday. And why do they do that to women? They do it to women because they don't want them to think. They don't want them to research and think about what is going to happen. They want you to get you in there before you have time to change your mind. And it's never that imperative that you have to be in by Monday. The doctor should tell you, take a week off and think about it. Do some research. Not hurry up and get you into surgery by Monday. It's just common sense to me. If a doctor would tell me something like that, that's a red flag to me. There can't be anything that imperative that you can't wait a few days.
Barbara, when you come down to Moundsville, are you also offering the full body scan?
Oh yeah, absolutely. Yeah.
And how much is that?
A full body is $395.
Okay.
And again, that's from head to the bottom of your feet. And you also get a free breast screening with that.
Okay. And is there such a thing as a routine thermography?
For breast screening, it's the same as mammography. After you get your thermal imprint, you come in and have the first one, come back 3 months later to get your thermal imprint, your baseline, and it's every year after that. So if you come in January, you're going to come back in April, February, March, April, yeah. And then every year in April, you're due for your regular breast screening.
Okay.
And the only time you would come back sooner is if a lump would pop up, or you'd have some kind of changes that were significant in your breast. Just like with anything else, you would want to be checked.
Okay.
But you don't have to have a thermography then either. You can go to your doctor and have a, ultrasound if you want, because your insurance may pay for it.
Okay.
Mm-hmm.
Okay, thank you.
Oh, you're welcome.
Okay, are there any other questions? Comments? Well, I thank you all for being here this evening. West Virginia Wellness, of course, is on a mission to help educate people about complementary, holistic, alternative, and integrative medicine. We are not here to diagnose, treat, cure, claim cures for, any kind of disease or illness, but we are here to educate you about options that you may have. And as we've learned here this evening, options that you may not previously have even been aware of. So again, I thank you for tuning in. Barbara, thank you so much for this fabulous presentation this evening. It was so interesting and informative and enlightening, and we really appreciate this. So thank you all. Please join us next month when we have a lady who will be talking to us about one of the hot new topics, intermittent fasting. So watch for announcement about that and the link to join in, and we hope to see you all then. Thank you.
Thank you.
Thank you so much for
Thank
having me.
you.
Bye-bye.
Bye-bye.